So, let's move to actions of sodium channel blockers. Let us know these actions of sodium channel blockers. These are a class of drugs that act by inhibition of sodium influx through cell membranes. Blockade of sodium channels slows the rate and amplitude of initial rapid depolarization, reduces cell excitability, and reduces conduction velocity. The enhancement of sodium channel block seen in rapidly depolarizing tissue or the use of dependent blockade. They are also responsible for the efficacy of these drugs in slowing and converting tachycardias with minimal effects on conduction in normal tissues stimulated at normal physiological rates. The modulated receptor theory, or the MRT, is based on a three-state model for the sodium channel. The modulated receptor theory, according to Hodgkin and Huxley, sodium channels exist in three primary states. First is rested, denoted by R, a closed state most prevalent at negative membrane potentials. Secondly, we have the inactivated, denoted by I, a closed state at depolarized membrane potentials. Lastly, we have the open or activated, denoted by A, the state through which the channels pass upon depolarization when they move from the rest to the inactivated state. Moving forward, we have the beta-adrenergic blockers. So, what are these beta-adrenergic blockers? Beta blockers, also known as beta-adrenergic blocking agents, are medications that reduce blood pressure. Beta blockers work by blocking the effects of the hormone epinephrine, also known as adrenaline. Beta blockers cause the heart to beat more slowly and with less force, which lowers blood pressure. They are used to treat high blood pressure, chest pain or angina, abnormal heart rate or the arrhythmia, congestive heart failure, and several other conditions. So these beta-adrenergic blockers, they suppress adrenergic-mediated ectopic activity. Propranolol, an example of beta-adrenergic blocker, is used in treating sinus tachycardia and extrasystoles. Another example is the sotalol, which is used to treat atrial fibrillation and other conditions that cause an irregular heartbeat or arrhythmia. Lastly, we have the esmolol. This is a drug used for emergency control of ventricular rate. The actions on potassium currents. Delayed rectifier are responsible for repolarizing the membrane. The delayed rectifier potassium channels are a family of potassium channels that allow a sustained potassium efflux with a delay after membrane depolarization. The outflow of potassium ions rapidly repolarizes the membrane. Block of potassium currents is thought to be the mechanism of action of many drugs. So we have this condition called the torsades de pointes, an uncommon type of ventricular tachycardia or disturbance of the heart's rhythm. It is a complication of the rare condition called long QT syndromes or LQTS, and it can be life-threatening. When the heart beats faster than usual, as in a case of torsades de pointes, it is called tachycardia. Torsades de pointes is French for the words twisting of points and refers to when the heart's two lower chambers or ventricles beat faster than the upper chambers, which are known as the atria.